Hello, and welcome to Israel Healthcare Highlights, where we share important information and inspiring stories from Israeli healthcare with English-speaking audiences around the world. I'm Bruce Rosen from the Hebrew University in Jerusalem, and my special guest today is Professor Mark Clarfield, who's a professor emeritus in geriatrics from Ben-Gurion University. We're going to be speaking with him today about his work at the International Health Medical School at Ben Gurion, and especially about his work about bringing geriatric care to young countries. Mark, please begin by telling everybody a bit more about your background and your career.
Okay. Well, good morning, Bruce, and thank you very much for the invitation. It's very nice to be here. Um, I grew up in Canada. I went to medical school, did my residency there, and I was specialized in geriatrics, family medicine, and public health. And when I came to Israel, I'm going to keep this very short. When I came to Israel, at some point, I moved to Ben Gurion University of the Negev in Beersheba, and I took over the Medical School for International Health, which is a 4-year Canadian American style medical school, but that focuses on global health. And in that work, I we used to we would send students at the medical school for 2-month rotation in global health in countries around the world. One of which was Ethiopia, and I became particularly interested in Ethiopia and spent about a 3-month sabbatical there with my wife, who's at your university. And I went there in particular to see how they cared for older people. The usual misconception is that these countries in sub-Saharan Africa are full of children, there's no old people. The first statement is true, the second is not, meaning there are a lot of people, the population is growing rapidly, the populations have a lot of young people in it, so the percentage of old people seems relatively low. But the absolute number of old people is actually quite high and growing very rapidly. So that's how I got interested, kind of a serpentine way, but through my work at the medical school in Israel, we would send students to Ethiopia, students would come back to us, and I went there to see for myself how they looked after older people. My being a geriatrician, that's my main clinical interest.
Okay, that's great background. So now tell us what you've been doing in recent years, and we look forward to hearing about the overall overview, but also perhaps some specific stories about individuals, individual countries you've been to, give it a human bent as well.
Sure. Well, our connection with Ethiopia has been maintained over the years. We've been sending students there for about 10 years. And I went there on sabbatical 5 years ago. And despite the conflicts both here in our fraught part of the world, as well as Ethiopia, which has suffered a terrible civil war, which is, although a peace treaty has been signed, there's low-level conflict that's going on. So our connection with Ethiopia is not in the center of the country, Addis Ababa, the capital, because everybody goes to capitals of African countries. We went to the provinces. We went to a place called Gondar, Gondar, and Mekelle, Mekelle, which are in the northern part of the country, where we have visited, where we have students, etc. And I I can briefly tell you two stories of people that I saw there in Gondar. One was a unfortunately, typical geriatric case of an older woman, 75-year-old woman with a stroke, who I looked after when I was working in the hospital at the Gondar Medical School. And like any old person with a stroke, this is a catastrophe. I mean, think about the word stroke. Stroke is, a stroke of lightning, a stroke of luck, a stroke of bad luck. It's a stroke where suddenly the person's brain is badly damaged. And this occurred because although this older woman, had hypertension, high blood pressure diagnosed, and although it was treated, which is not the usual case in Ethiopia, it's rare that they're diagnosed and rare that they're treated, although treatment is cheap and easy to do. This woman was being treated, and she went to see a private physician who told her blood pressure was fine and she should stop her medication, which she was a compliant person, did so, and had a stroke 3 months later. So her life is ruined because there are very few ongoing long-term services for older persons in sub-Saharan Africa. There, her family is going to have to look after, and the lives of two of her children are completely devoted to care for this elderly person. This is a preventable, this is not high tech, this is low tech, low touch, cheap. People, their drugs are available and reasonably priced, even in Ethiopia, for the poorest people. So the lesson I learned was that in Ethiopia, with respect to high blood pressure and treatment and prevention of stroke, they're back where we were in Canada and the United States when I was an intern. When I was an intern, we were taught that half the people in Canada and the United States, and it was, of course, this case in Israel, half of older people had high blood pressure, half of them had it diagnosed, half of those people were treated, and half of those were treated correctly, meaning that about 3 or 4% of people were getting proper treatment. That's not the case anymore in wealthy countries, but it is the case in sub-Saharan Africa. The second case I saw there had to do with, I gave a lecture to the medical students at the Gondar Medical School about was sort of my introductory lecture on aging, which I give to different classes. And they were, I know, not boasting, but they were quite interested in the subject. And they came up to me afterwards and said, we see old people, but we don't know what to do with them. So thank you very much for giving us some guidance. Oh, you're welcome. That night I got an email from one of the people in the audience named Baruch, which is Amharic for Baruch, which is blessing, and your name in Hebrew. So his name is Baruch in Hebrew and Baruch in Amharic. And Amharic and Hebrew are both Semitic languages like Amharic, Hebrew, Arabic. They all related. Probably Baruch in Arabic is probably not dissimilar. Anyways, Baruch wrote to me to tell me that he really enjoyed the talk, and it especially spoke to him because he lived with his grandmother. I said, that's interesting. I wrote back and said, thank you for your kind words. I said, is your grandmother, where does she live? He said, 5 minutes from the hospital. I said, wonderful. I said, could we visit her? He said, let me check. I'll get back to you. The next day, we were on our way to her flat, which is basically a small concrete shell, which in Gondar is actually quite a luxurious place. And Baruch, was from a town further out in Ethiopia, lived with her because he could afford to live with his grandmother while he went to medical school, and she looked after him and he looked after her.
Oh, that's nice.
It was a delightful story, and he showed me proudly the corrugated iron roof that he'd built for her, because before that she'd had like a roof made of palm fronds and vegetation, which worked in the summer, but in the rainy season she lived in soaked. So he showed me this roof that he'd built, and he showed me the squat toilet that he built for her, which she used to have to go out into the street somewhere. And we met this old lady, and she was 85 years old. It's too bad I could have put a picture up for you, but here's a healthy old woman who supposedly doesn't exist in poor countries, right? They're all children. What we call a typical healthy older person, 85 years old, no glasses. She had all her teeth. She had all her marbles. She would walk. Gondar, like Jerusalem, is a very hilly city, like San Francisco, like Jerusalem, a lot of hills and dales. And she would walk everywhere. And she would walk to church every Sunday, which was, I asked, a 3-mile walk, 5 kilometers, there and back. No problem whatsoever. So we see that even in poor countries, that what I call old age in young countries, they do have a lot of old people, and they have the same problems that we see in wealthy countries. Sick old people who sometimes become sick because of poor medical care, and healthy old people because they've got good genes and they've been lucky. And apropos of our connection, so we continued in Israel, we continued our contact with Gondar, and we organized a project which involved your university, the Hebrew University, Ben Gurion University, our university, McGill University, where I used to teach, and Gondar University, where we have this connection. And we were funded and are funded by the Royal College of Physicians and Surgeons of Canada, which is the group
Wow.
the group in Canada that sort of like the state colleges in the United States that determine whether your specialty papers are recognized. And we were funded to to go there back to Gondar, and we brought two little ultrasound machines. When I say little, I mean, the ultrasound machines used to be big things that looked like X-ray machines. Nowadays, you can have an ultrasound machine that is big as a stapler, the head of it, and it's connected to a little computer, and you can do what's called patient-oriented um, ultrasound right at the bedside. So it's a bit like a stethoscope. You take this ultrasound and you can check their bladder, you can check the heart, you can check the kidneys, and the thing cost a couple of $1,000. And with our budget, we bought a couple of machines, took them to Ethiopia, taught the three physicians, new young physicians who worked in the emergency room at Gondar Medical School. We brought them down to Addis Ababa, and we had a 5-day special course with teachers from McGill University, and I was there too, representing Hadassah and Ben Gurion. And the machines work, they're still there. They learned a skill that is high tech but low cost. I mean, ultrasound is high tech, but given the price of computing nowadays, even poor countries can afford to have a one ultrasound machine in the emergency room of a hospital, and they now have two, funded by the Royal College of Physicians of Canada, put together by a consortium of two Israeli medical schools, one Canadian medical school, and one Ethiopian medical school, which, as I mentioned, we've had long standing. So these kinds of things can go on and wend their way as funding becomes available and as you find people who are interested. And we're about to go back there again in July or August. And this time we're going to teach a bone marrow aspiration, which is a way of sticking a needle into people's bone marrow to pull out a little chunk for a biopsy.
Okay, this is
Anyway, that's
amazing.
the next project.
This is wonderful. I'm going to again ask you two questions. You take them in
Sure.
whichever order you
Go
want.
ahead.
How does the Israel factor play in here? To what extent, from your experience, are Ethiopia, but African countries more generally interested and willing to receive assistance from Israel? And also, it's interesting to hear about the Canadian connection as well, the potential role for Israel as part of a multinational project. That's one
Right.
question. The second is, what do you see in terms of scalability here? To what extent can Israel be playing a broader role in healthcare in Africa?
Right. Okay. Two good questions. So the first one, or let's start with the second one, scalability. These are very cheap programs what we do cost a couple of tens of thousands of Canadian dollars, which is not very much. It brings skills that once the doctor knows how to do it, they can keep up by internet, by email, which is what we do with Zoom like this. So it's relatively cheap. This is very, very low cost um, projects that have a huge benefit. They now have eyes. They now have an ultrasound in the emergency room that they didn't have before that continues to work, has been working for the last 2 years. And for really a few $1,000s. The Israeli role is one, Israel is Israeli medicine. Let's talk. I can only speak to medicine. I can't, I'm not a politician. I'm not a political science. Let's talk about health. Israeli healthcare is top notch. We have a very, very good medical system, good medical schools, good teaching hospitals. And people around the world know this. And in particular, in sub-Saharan Africa, Israeli medicine is extremely well known. There are a lot of projects that are going on, sometimes as part of a multinational WHO kind of project, UN project, international consortia, or sometimes little things like the one we did. But wherever I went, and I've been to, if you're asking Africa, I'm familiar with all of East Africa, which includes Kenya, Uganda, Tanzania, and Ethiopia, and maybe Rwanda. But those four countries are all clustered together, and I've been to all four of them in different contexts, and all of them are extremely positive towards Israel in general, but Israeli healthcare, they see it correctly as high quality. And the other thing they tell me, and you'd have to do a study to see if this is generally true, but they're very, very grateful for they say that the way Israelis come in, as opposed to Europeans or Americans, is, you might be surprised with this, but with a kind of modest demeanor. We don't try and we know we were a developing country ourselves not very long ago. You know, in my lifetime, in 1968, 69, the first time I came to Israel, people didn't have phones. You know, there was no air conditioning here. Everybody took buses. It was, I tell them that in Africa that we came from your situation 50, a mere 50 years ago, in general, and specifically with respect to health. So they get the feeling, I think, that we know where they are, where they're coming from, and what they can do, as opposed to, you know, pie in the sky projects. And that's not to denigrate in any way the other fine work that's been done by other people around the world. I don't mean to be boastful, but this was the surprising reaction I got from everyone in East Africa, and in particular Ethiopia, which I know best. Does that that's
That's exactly what I was looking for, Mark.
okay?
In a minute, I'm going to thank you and wrap up. Before I do
Okay.
so, any parting thoughts from your side?
Well, my parting thought is always that aging, if anybody who wants to get in the ground floor of a upgoing elevator, escalator, the world is aging. Israel's aging, Canada's aging, United States, Europe is aged, and Africa is aging. And again, although it seems like if you look at the percentage over age 65 in those countries, it's low, but it's low and it's going up like this. And so anybody who wants a career, an interesting career, first of all, I would recommend aging in its various, and of course, I don't need to speak to you. You're from Brookdale, which has had a lot to do with aging. I don't have to convince you, but people are listening. That's
Sure.
in general, and in particular, aging in low-income countries, because we in the wealthy world have already been through, or largely through, our demographic transition. They're just entering it, and they're very hungry and thirsty for knowledge about what we did right and what we did wrong. And I think that it's really a lot of fun and politically, professionally, very satisfying to deal with this field in this particular part of the world.
Mark, thank you so much. This has been both informative and inspiring. So thank you for joining us today.
My pleasure, and thanks to you, Bruce. All the best.